Hello everyone, I'm Susan from Myanmar.
And I'm Rubat from Bangladesh.
We are both postgraduate students at the University of Auckland.
Today we are excited to have the opportunity to talk about a very concerning and serious man-made global health issue, that is tobacco, and why this should definitely be addressed in the next Global Health Assembly 2019.
We are highlighting this issue to be included in the World Health Assembly agenda because the tobacco consumption is one of the most important behavioral risk factors for top 5 leading causes of death globally.
Tobacco kills half of its user, which is 7 million people each year, and among those deaths, more than 6 million deaths are due to direct tobacco, while the rest deaths are caused by secondhand smoke.
However, all of these deaths caused by tobacco are preventable.
Nowadays, there are 1.1 billion smokers around the world, and 80% of them are living in low middle income countries.
More importantly, according to the Global Youth Tobacco Survey from 1999 to 2016, the number of boys and girls who use tobacco products are approximately 25 million and 13 million respectively, and this is an alarming issue that all the global health actors should pay attention.
Although there are global interventions and strategies to reduce the burden of tobacco, the negative impact of tobacco use is still a big challenge for the health industry. Tobacco affects everyone in the world and leave no one behind. It could affect anyone regardless of age, location, sex, or income and can harm every organ of the body. It can also cause sudden death in infants because of tobacco smoke.
There are more than 4,000 chemicals in tobacco smoke, and many of them are harmful and known to cause cancer. There is no safe level of exposure to secondhand tobacco smoke.
Moreover, tobacco users are more prone to develop non-communicable diseases like heart diseases, strokes, and lung cancer, which are the leading cause of death globally.
So, what are the determinants and consequences of tobacco use? In some countries, there are unhealthy culture of use of tobacco as social norms. Moreover, law and policies play a crucial role in controlling tobacco.
There are some social determinants of inequities in tobacco use. Use of tobacco can aggravate poverty and it could reduce the quality of life of not only to smokers but also the people around them.
In some low socioeconomic countries, children from poor families have to work in tobacco farming to support their family. They are suffering from green tobacco sickness, which is caused by the absorbed nicotine through handling the wet tobacco leaves.
Moreover, tobacco users who die prematurely deprive their family income, raise the cost of raise the cost of health care and hinder the economic development.
So, what are the actions taken by the global health actors in order to combat the tobacco problem? The first Global Public Health Treaty, the WHO Framework Convention on Tobacco Control (FCTC), is developed in 27 February 2005 by countries in response to the globalization of tobacco epidemic.
It had been ratified, accepted, and approved by 181 parties, covering more than 90% of the world's population currently, and is implemented its strategies in almost all over the world.
And there is a global policy package to fight the tobacco, and it is called Empower.
However, there are still some gaps, needs, constraints, and barriers in implementing the global strategies due to lack of human resources and financial supports. Furthermore, there are gaps in delivering effective tobacco education, and it could not reach to all places, especially to the rural areas.
More importantly, the huge constraints is facing due to the interference by the powerful tobacco companies and lack of law enforcement, lack of political will by the responsible governments, and the needs of better legislation in some countries.
Moreover, as the trend of using tobacco in women is increasing these days, lack of specific tobacco control measures to reach the target groups is also a big challenging issue. In addition, there is no enough research of smokeless tobacco, which also kills people.
So, there are some possible solutions recommended by the WHO. It includes integrated time-bound actions of the global countries, the accurate data collection, which is crucial for further actions, and this is the area which is urgently need to take action. Moreover, the countries should strictly follow the guidelines consistently.
We also think that there are some other actions that the global health actors should take priority in taking action. This includes raising the capacity in tobacco control, especially the developing countries who where the resources are scanty, allocate more funding in quitting tobacco, creating more smoke-free environment and activities that all people could accessible, and actions should be targeted mainly on young people and women as the trend of using tobacco is high in those group of people. Moreover, empowering the monitoring systems in those countries who are weak in data recording and reporting.
As tobacco is the hazardous substance that could endanger the health of the community, yet it is 100% preventable.
So, we would like to request all of the board members of the World Health Assembly to address and highlight these global health issues, tobacco in the next World Health Assembly Agenda 2019.
Thank
Thank
you
you
so
so much,
much,
everyone.
everyone.